Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter. Welcome to the Mind Myself podcast, Dr. Ryan Wagner. We're so grateful to have you with us.
Thanks, Esther. I'm glad to be here.
Excellent. So to start off the conversation, can you remind us of your credentials and how you came to this health journey that you're helping us with?
Sure. I studied as a pharmacist, and I knew I wanted to help other people, but that kind of turned when into functional medicine as my own health problems came about, as well as my family and my wife. So that took me down the path of my curiosity and finding out why, because functional medicine gets to the root cause of the problem. And I wanted to know more. Conventional medicine wasn't giving me all the answers, and I needed to do some more research to fix myself and those that I love. So that's what's got me involved into functional medicine.
Wow, what a great reason to be in that place. So let's just dive right in. We're talking about functional medicine today. What is functional medicine, and how does it compare and contrast to conventional Western medicine?
So functional medicine does have conventional medicine at its backbone. So there are some similarities. Both are practiced by licensed medical professionals. You've got evidence-based medicine. I love that scientific approach. And we're employing different diagnostic tests to see, exactly what's going on and give us more awareness. And we may even use prescription medications. But that leads to some differences, right? And the difference is really the guiding philosophy. The conventional medicine is really focused on symptoms and treatment and kind of masking those symptoms, where functional medicine addresses the illness by addressing the underlying cause. I said what the root cause actually is. And conventional medicine's been equipped to, look at these symptoms, where's the illness, and it's great for addressing the acute problems, the urgent problems, the car accident or the infection that might be going on, the broken bone or the trauma. So there are some key differences between the two. Functional medicine is more health oriented. Conventional medicine's more disease oriented and fixing the disease. Functional medicine is more patient-centered, and conventional is more doctor-centered. Functional is more holistic, and conventional is more specialized. And functional focuses on prevention. Let's stop it at the beginning, where conventional is focusing on detect the disease and make the diagnosis. So hopefully that kind of compares and contrasts the two of them there, and you can start to see the differences. But really at the core, functional medicine is being built and taking conventional medicine one step further.
Well, I love that, because complementary and holistic medicine, it's not throwing out the baby with the bathwater. It's how do we integrate? And so it's like in your description, it's like saying that functional medicine is taking conventional medicine to the next level, and it's about integration rather than one or the other. And yes. I just believe it's so important to have those together, which is great.
Mm-hmm.
So does conventional medicine typically reject functional medicine as a discipline, or what's the political climate or the conventional climate around that?
No, functional medicine doesn't reject conventional. Functional medicine is using it, right? And functional medicine just takes it, like you said, more to an integrative approach and personalizing it with the patient. So the process involves the prevention and the management and really understanding what that root cause is, because a lot of chronic diseases are complex. It's not just one root cause a lot of times. We've got entire systems in our body and they're all connected. There's lots of things that are cyclical and one thing leads to another. I like to use an analogy for a lot of my patients. You know, if you've got this pain in the butt that you just can't get rid of, and you start to look at the root cause, you may be sitting on some tacks. There's more than one tack there, right? There might be 5 or 6 of them that you're sitting on. And I can remove one of them, but you still have that pain in the butt. And you have to remove another one. And it isn't till you remove all of those tacks that the pain finally goes away and everything is healed. So it is taking that deeper approach and identifying all those individual tacks.
Got it. Now I understand there are 3 main pillars that are the foundation of functional medicine. I think you referred to a couple of them, but I think it would bear restating.
Sure. First off, it's patient-centered, right? We're caring for patients, their families, and in very individual, meaningful ways. It's creating that client-doctor relationship, that partnership, on a whole new level. So we create an individualized plan. There is no protocol or, practice for a certain disease. It's individualized for that person. The second one is it's science-based. We're using evidence-based medicine and research and clinical expertise. And it's a whole complex web of, genetics and medical history and physiology, their lifestyle, behavior. But we're looking at things from an inside-out approach, and might have some psychological imbalances in there as well. The third one is, like you mentioned earlier, it's integrating. It's integrating best practices from multiple disciplines. So functional medicine combines traditional Western medicine along with different therapeutic approaches. It could be, like I mentioned, exercise and lifestyle, but it could be Eastern medicine practices and doing different lab tests, diagnostics, different botanical supplements, therapeutics, diets, detox programs, stress management techniques, mindfulness. There's lots of integrating going on to create that individualized plan for that specific patient.
Right. And maybe you could talk a little bit about prevention, because I think that's probably one of the keys that you focus on as well.
Yeah. So functional medicine is prevention at its core. You might know the saying, an ounce of prevention is worth a pound of cure. So
Yeah.
The goal is to really get the body functioning optimally and to allow it to support itself to heal. It's got the innate knowledge and built into our cells, into the DNA, to allow it to heal and come back. But we don't always give our body what it needs. And that body can't rebalance itself when it has blocks and doesn't have what it needs to do that. So there's lots of different tools that we can utilize beyond just, pharmaceuticals and surgery like we have with conventional medicine. I've mentioned detoxification programs. I can kind of distill things in functional medicine down to 3 main problems as well. There's crap food, bad food, stress, and toxins. So detoxing our body and having detox programs, having programs to manage stress and do different stress management techniques, and improving a patient's nutrition and building that relationship with them where they start to think about what they're putting in their body, is integral and one of the main tools for functional medicine.
Wow. So much to think about. So what kinds of diseases and health issues are specifically addressed, would you say, overall? If you had to pick a list, what kinds of diseases or illnesses would functional medicine address well?
Well, I mentioned conventional medicine is great for the acute stuff,
Yes.
the traumas and the problems. Conventional medicine is great for the chronic stuff. And chronic disease all starts with inflammation. But where does that inflammation come from? That inflammation comes from the lack of sleep, or not eating things right, or having that stress, or maybe your immune system's out of balance and there's a little infection going on. Or maybe you actually had some physical trauma and that's causing more inflammation. Digestive problems, what's going on in your gut? Maybe the inflammation's coming from a toxin that's still in your body. All of that inflammation is causing chronic diseases like just your common allergies, your mood disorders like depression. Cancer can be the end result of this inflammation that's been going on for a long period of time. And being overweight and obese is just another imbalance in the body. And, fat causes more inflammation. There's all kinds of digestive disorders with inflammation in the gut, irritable bowel syndrome, arthritis is inflammation, heart disease is inflammation. I mentioned the mood disorders, but even anxiety has got your nervous system on high alert. So bringing down somebody's blood pressure or any autoimmune disorder, your immune system is out of balance and it needs to come back into balance. Could be hormonal issues and thyroid problems, even just chronic pain in our system.
And what does a functional medicine appointment or series of appointments, what does that look like? How does someone prepare, and then what do the sessions look like?
So if you have a visit with me, you can expect to do a lot more talking than I am, because I need to get to know all the details, and you're going to spend more time. It's not going to be 2, 3, 4, 5 minutes with the doctor. We're talking half hour, maybe an hour session to dive in even deeper. And that initial consult may be the longest. It may be 2 hours to gather all the information I need to put the pieces of that puzzle together. But it's about listening and training the patient to listen to themselves as well. What is their body telling them? So we're going to gather all of your personal history, your family history, your symptoms, when they started, your different lifestyle habits, your healthy behaviors, your not so healthy behaviors, your labs, your diagnostic tests that you've already done. This is all going to help me determine and uncover those root causes to the health problems, and allow me to order what physical exam, laboratory tests, supplement you need that might be lacking to bring things back into balance. And those, we could prescribe all kinds of things from, regular sleep and getting, your circadian rhythm back in order, or exercising and doing strength training to build up your muscle mass again, or just a healthy routine. Because once you got a healthy habit or routine in place, you take the thought out of it. And maybe we need to bring more mindfulness to you and your life. So we may have to test hormones and imbalances, or maybe a nutritional deficiency to find that out. So there are tests involved, and they don't have to be. We can, if that's not in someone's budget, we can always work around that. But a lot of it comes down to eating right, exercising, those basic core things that we all know that we should do. But we need help getting there.
Totally. It just makes so much sense. And like you say, we need help getting there sometimes. So on average, and I imagine the answer is it depends because everybody's different, but on average, about how many sessions would you say are useful to get people started in functional medicine?
Yeah, and usually I would say the minimum is working with me like 3 months. Just to, if you're going to create any lasting change, um, you know, I've heard different people say at least 8 weeks. In maybe it's 16 weeks to create some of those lifestyle changes. Um, so the minimum is probably that 3 month mark, and we usually meet twice a month to find out your progress and make changes or enhancements and to continue to tweak it along the way. And I've had clients that have worked with me 9 months to a year, and then it turns on into an ongoing relationship just for maintenance. um, some have a lot of things to unpack.
Right.
Remember, prevention is the core of this, and that whole pound of cure. Well, if you're already, diseased, you have some more work to do. That entire pound of cure is going to take some time to work through.
Right. So it sounds like the earlier somebody comes to functional medicine, the better it's going to be because there will be some work involved.
Yeah.
So excellent. So there are the core body systems. You've addressed them all, but just as a wrap up summary, what are the core body systems that you're working with in functional medicine that encourage natural healing?
That first step, and they call me the food doctor, is around optimizing nutrition.
Yes.
So we've got to get the food right, and we got to get those nutrients into the cell where it actually has an effect. So that involves digestion and absorption and the inflammation in the gut and fixing all of those things. But that first core piece is optimizing nutrition. Then it gets into hormone balance is another core system through functional medicine. And imbalances, for any number of reasons. It may be medications that they're already taking. It may be diabetes or thyroid disorders. But hormone balance is another core that we need to focus on. And I mentioned earlier that inflammation is at the beginning of all chronic disease throughout the body. So inflammation plays a vital role because it's a foreign invader to our system, and our immune system sees it as an abnormal cell, and sometimes we're overreactive and causing more inflammation and more illness. If we're optimizing nutrition, we got to focus on the digestive system because we have to get that into the cell. Our bodies are fueled by food, the food that we eat. And it's the saying, we are what we eat, but we are what we eat, digest, absorb, and assimilate those nutrients into our cells. So there can be a breakdown in that process anywhere along the way. And I mentioned the three pillars with food, stress, and toxins. The other two, toxins, our body is intelligently designed to eliminate toxins. However, we've got a highly processed diet, the SAD diet here in America, and we've got a really chemically filled environment that we live in. It can just be overwhelming to all of our detox organs. That overwhelm and stress in our organs can be physical stress in our body. So that last one is stress. It can be physical stress in our body as inflammation or an infection, but it can be the psychological stress as well that we need to bring into balance. So that's kind of the systems at their core, and kind of distilling things down.
What a wonderful discussion. I learned so much today myself too. So what do you want to leave people with today?
Functional medicine recognizes the need for the life to be in balance, right? We have to have connection and community and love and support. And sometimes, to get all of these pillars right, we need additional support from a personal development standpoint. So a sense of empowerment. And, I have a Lifebook Premium class that can help put all those things together. But health and wellness is at our our core foundation. We can't have a successful relationship or career or anything financially if our health doesn't allow us to do that. So let's get our health and wellness first. And sometimes we have to correct the relationship in order to fix that, because there's so much stress from that relationship or that job, that career, that we have to bring all of these things into balance in order to have that life that is optimal, not just, surviving, but thriving.
I love that. What a powerful way to end. Ryan, thank you so much for being here. And I highly recommend a session or series of sessions with Dr. Ryan, and all his information is below, and check out his profile for sure on the Mind Myself website. Thank you again, Ryan, for being here and sharing your valuable time and wisdom with us.
No problem. Thank you, Esther. Much appreciated.
Thank you for being with us at the Mind Myself podcast today. We know that time is precious, and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guests directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions, and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.